The purpose of this technique was to help clients seek what they're avoiding, what they're fighting, and replace fear with a wish. Milton Erickson and Jay Haley are also credited with the development and application of paradoxical intention technique, which is commonly used in family therapy. The goal of paradoxical intention technique is to help the client reach the point where they no longer fight their symptoms, but instead exaggerate them. As a result, the symptoms will continue to decrease until clients are no longer bothered by them.
One, have I established a strong bond between the trust of myself and the client? Number two, might the use of paradox have a boomerang effect so that the client feels tricked and thus becomes more resistant? Number three, how has the client responded to the use of other techniques? Number four, am I clear on what I expect to accomplish? And do I have an educated sense of how my client might react to this procedure?
In this scenario that we're going to show you, the therapist is going to use the paradoxical intention technique to help the client overcome her depression. By doing this, the doctor is trying to establish a relationship based on equality between the couple.
Welcome back, Mr. and Mrs. Martinez. How y'all doing today?
Oh, we're pretty good.
Good. Looking at your case file, unfortunately I have to read over the case file before everybody comes in because I've got quite a bit of clients, and unfortunately my memory isn't as good as it used to be, and I can't remember everybody's file off the top of my head, because that's what happened with age. But you can look at your case file. Mr. Martinez, you were in here before because you claimed, you claimed you were in here for some anger issues, and you seem to be doing better. And looking at your file, you mentioned I've given you some techniques to use. And have you been working using these techniques to help out with your anger?
I have, and I think I'm doing much better.
Good.
I'm able to, in my opinion, I'm able to diffuse situations and just walk away and then come back and talk. I feel that I'm doing a lot better.
Okay, so since we last met, tell me what's been going on. Anything new come up? Any issues?
Well, in regards to my wife, I think she's, I see her a little bit depressed, but also at the same time she still likes to argue, to fight, and tries to push my buttons, and she's not helping with the situation.
Okay, Mrs. Martinez, tell me what's going on with depression, and tell me everything what's been going on.
Well, Counselor Smith, it's very hard for me to say that he's been improving with his anger issue, because when I'm at home, he seems to be just picking on me all the time too, and I feel like he always wants to know where I'm going, where I've been, how long I'm going to be gone, who I was with, and it just irritates me when he asks me those questions.
Okay.
And it's like in the mornings I have no motivation to get up anymore. I'm just, I just rather just stay in my room.
Okay, so now you mentioned he's been picking on you. And you also mentioned in the same sentence that he's been wanting to know where you're going. And so, again, give me the worst case scenario that he's been picking on you about.
Well, it's like every morning he's always asking me, what's for breakfast? Or what's for lunch? What's for dinner? I mean, he's capable of making his own food, so I don't know why he's even asking me. I mean, I understand that our marriage is supposed to be an equal relationship, you know, it's a give and take. But I just don't feel like that sometimes.
But do you think it's picking on you? It's telling you to do things that wives do for their husbands. Breakfast or getting my clothes ready, and then you want to fight.
Well, I didn't grow up that way. I grew up that it's an equal marriage, and we both, you know, help each other when we can. I mean, you don't do their, you know, you're not always doing their laundry, cooking for them, you know, getting their clothes ready. That's, you know, are you going to do that for me?
If you need to, if
Well,
you need me to do it, I'll do it.
Well,
Let's back up.
That's what I mean. He can make his own breakfast.
Ms. Martinez, after listening to what's been going on at home with you and your husband, I think that you need to start being a bit more subservient to him.
See, I told you need to listen to what I'm saying. I'm right. If you listen to me, we're gonna be good. We can go through this problem and overcome it. But listen to what I'm saying.
Excuse me, Counselor Smith? I don't think so. We've been married for many years, and that has never happened in our household.
Yes, that's why you're depressed. I think you need to start being subservient, and like Mr. Martinez says, if you start listening, things might take a turn for the better.
That's not going to happen in my household. I don't think so. No.
That's why-
It's an equal marriage, and that's how we enter our marriage, and that's how it's going to continue. We're going to be equal with each other.
And we're gonna continue having problems.
I don't
So
think so.
either
My next
Well, I
solution
guess
would-
we'll give it a try. We're gonna be equal. That's it. There's no question
that's not
about
gonna
it.
work. You need to listen to what I'm saying. If you listen to what I'm saying, everything's gonna work out. We're not gonna have any problems. But that's your problem. You're always depressed. You don't want to do things. You don't want to listen to me.
Your husband seems to be a good man, and I think you actually need to listen to him and see what he has to say. Take his advice. Okay, Mr. Martinez, we need to wrap up our session. Mr. Martinez, let's, again, these are only suggestions, so I can recommend to try these. It's all up to you, but let's try you being a bit more subservient to your husband, and try and see how it works, and we can, during our next session, we can come to a conclusion if it actually worked or not.
Okay, Doctor, sounds good.
We'll give it a try, but I'm telling you, it's not gonna happen.
Let's try it.
Looking at my calendar here, why don't we meet 3 weeks from today?
Okay, Doctor.
Sounds good.
Does, here's a list of 15 symptoms that paradoxical intentions have been known to treat. Number 1, anxiety disorder. 2, agoraphobia. And 3, depression. Number 4, insomnia. Number 5, juvenile delinquency. Number 6, stress. Number 7, procrastination. Number 8, disruptive behavior. Number 9, temper tantrum. Number 10, obsessions. Number 11, compulsive behavior. Number 12, phobic reactions. Number 13, behavior tics. Number 14, urinary retention. Number 15, stammering. J. Haley's 8 specific facets of paradoxical intention. Number 1, establish a relationship with the client. Number 2, define the problem. Number 3, establish a goal. Number 4, offer a plan. Number 5, disqualify the current authority on the problem. Number 6, give a paradoxical intention directive. Number 7, observe the client's current response to the directive and continue encouragement. Number 8, avoid taking credit for the improvement.